John got in a car crash and broke his hands and legs. To suppress his pain, Dr. Paul wanted to give him morphine, an opioid. But before this, Dr. Paul asked, what is the difference in exogenous opioids and regular opioid drugs? Well, to answer this question, opioid drugs include a range of drugs that have been classified as opiates, semi-synthetic, and synthetic drugs. All these drugs mimic the effect of small pain-killing peptides our body produces. These are called endogenous opioids and can be classified as endorphins, amphetamines, and endorphins. All these molecules bind and activate opioid receptors, which are scattered throughout the nervous system. We'll be focusing on mu receptors. So what happens to John at a molecular level when Dr. Paul gives him morphine? When an action potential reaches the end of the presynaptic neuron, the positive charge causes calcium channels to open and allow calcium to flow in. Increased calcium levels inside the neuron triggers the fusion of neurotransmitter-containing vesicles, causing the release of neurotransmitters. The neurotransmitter then binds to receptors on the postsynaptic neuron to activate channels that allow sodium to flow in. This increases the positive charge within the neuron, a process called depolarization. This positive charge activates nearby sodium channels which allow more positive charge to flow in. This in turn activates other nearby sodium channels, resulting in a domino effect creating action potential on the postsynaptic neuron. To understand how these two processes work, let's take a closer look at opioid receptors. These receptors are a special kind of receptor called a G-protein coupler receptor. When an opioid drug binds to the receptor, the G-protein separates into two subunits, alpha and beta. The beta subunit is released and interacts with nearby voltage-gated calcium channels, preventing them from opioing. Now, even when there's an action potential, these channels can no longer open. Without calcium influx, no neurotransmitters are released. However, as opioids suppress pain, they become highly addictive. Unfortunately, John has become addicted to his morphine medication and has overdosed. The paramedics quickly come, injecting him with Narcan, an opioid overdose reversal drug. How does it work? Well, Narcan releases naloxone that quickly binds to the morphine receptor, preventing morphine from attaching to the opioid site and allowing for normal neuronal function to occur. Fortunately, John has been saved, but how can we solve this opioid epidemic crisis? First off, we should make Narcan a widespread availability with low cost. Second off, the United States should lower the price of less addictive medication to prevent opioid use. For more information, please visit the PDP website.